Welcome to Meaningful Interviews with Rabbi Chaim Dalfin. I'm your host. I'm here today with a very special woman. Her name is Dr. Chana Pechenik from Buffalo, New York, but originally from Ecuador. And you don't know this, Ruth Chana, but my mother grew up in Costa Rica.
Really?
That's right. But after the war, she was a survivor, and they came to Costa Rica. But for some reason, she didn't teach me Spanish. So I wish I would know Spanish. It would really be so much more helpful. But that's not what it's about today. I'm here today with Chana, Dr. Pechenik, who is a clinical psychologist, a social worker, and particularly deals with the issue of suicide, and more correctly, prevention of suicide, which I know is her passion, to talk about it, to teach it, and to really implement it. So we'll talk about that as far as your work is concerned. I just want to read for everyone a little bit of her bio, okay? She's been in clinical practice since 1999. Since 2008, Dr. Pechenik has served in different capacities at the New York State Office Mental of Health, providing a clinical leadership in suicide prevention and forensic services, being principal investigator in federal grants, and currently as principal psychologist at the Buffalo Psychiatric Center, where she is the director of the APA-approved psychology internship programs and oversees the facility's centralized psychological testing services. The last 5 years, she's done a lot of work in the Frum community, in the Orthodox community, in the observant community, I guess probably mostly through the phone and Zoom. I don't think you have many Frum people in Buffalo. Probably Muncie, Lakewood, Brooklyn. So that's very important.
Park. Yes.
Borough Park, where I live, where I'm sitting right now. And that's something that's very important. And I'll tell you why I asked you to come on. It's because of this book that I wrote about a year ago called Tanya on Mental Health. I'm a teacher of Tanya, and I realized that Tanya has so many facets to it, including ideas, suggestions for mental health as well. I'm not going to tell you that that's the bulk of the Tanya, and that's the way we literally learn the Tanya. But when we delve deeper into it, we could take out a lesson from the chapters, and that's what I did here. I chose per chapter one or two ideas with methods and lessons per chapter. So it's kind of a more user-friendly book, and I really hope that you'll get a chance to read it, look at it, and maybe learn it with me. You know, I mean, in the course that I'm giving starting next week. And hopefully you'll be able to improve it, because this is just like a first step. It has a lot of potential, but we need professionals to take, that's as much as, I dabble a little bit in psychology and things like that. I'm not the professional. I'm a rabbi, a teacher, a writer, a researcher, a historian. You're the professional. So it's really special to have you here to deal with these things. So the way we'll set it up is you'll tell us briefly a little bit about yourself, then we'll talk about your work, and then in the second interview, the second installment, we'll talk more about your background and other things. So please take it from here.
Well, thank you for having me. And I have to say that years ago, when I first started studying the Tanya, I thought, I learned this in graduate school. This idea is what I was taught in graduate school. So I am looking forward to reading your book.
Thank
It's,
you. Thank you.
yeah, yes. So let me tell you how my work began in the Orthodox community specifically. So back in 2016, I hosted the first suicide prevention conference for the state of New York. And so we had a lot of attendees who were professionals who were providing services to different communities. And at the end of one of my presentations, I had two psychologists who were working in state hospitals that served the Frum community who came up to me and they asked me, what are you doing for the Orthodox population? We primarily deal with the Orthodox community and there are suicides and we really don't have resources. So that was back in 2016. At the time, I was the director of the Suicide Prevention Center here in New York State. I am no longer in that role. I was in that role until 2020. So in 2019, that's when I started focusing on how can I make the transition from a leadership position for the state of New York to be able to provide more education and services to this population that had a need. And that's how in the last 5 years, this has been a major focus of my private practice. I continue to work for the state of New York, but now I work at one of the psychiatric hospitals here in Buffalo.
Okay.
So I see you grabbing the book. Is it because it's falling or because you're going to reference to it?
No, because there was a glare. Whatever.
Oh, okay. Okay. All right. So, so back in 2016, when this psychologist approached me, there had been a very public suicide in the community that was followed by a second one.
In which community? In which community?
It was in the Brooklyn community. So it coincided that at the same time, the Jewish Learning Institute, JLI, was starting a division specific to the youth and to teaching emotional resilience in schools. So I am one of the clinical board members with the with JLI's the institute, and it has been one of the biggest honors of my life, I think, to be able to work with JLI, with the Wellness Institute, pretty much from the beginning, and to bring some of the research that I had done and some of the connections that I had at the time to help frame what quickly became a very successful organization. I have told my colleagues at the Wellness Institute that what they were able to achieve in the first 2 years was unheard of.
So excuse me, Chana, the
Yes.
Wellness Institute, for those that don't know, is a JLI program or another program?
Yes, so it is the organization within JLI that focuses on bringing suicide prevention and mental health education to parents and to schools, and they have also developed curriculums that are currently being implemented in some Orthodox schools, modern Orthodox and conservative schools across the country.
Okay.
And they provide also free workshops for parents. And the curriculum that has been developed is implemented in schools to teach kids emotional resilience. So
Okay.
it's part of their curriculum. So it's called upstream prevention. So let's teach some skills for kids to be able to manage stressors, and to be able to communicate what's going on with their teachers and with adults before it becomes a crisis. So it's the most effective form of suicide prevention, and also teaching emotional resilience.
Okay. I would like to move along now and ask you the following. Why do you think there is such a proliferation of suicide and the need for suicide prevention in our communities? Are there any statistics as far as, has it been this way? Was it this way 40 years ago? I remember a friend of mine, someone who I knew from yeshiva 40, 50 years ago, very bright young man, and one day he took his life. And that was an exception for us. We thought it was an exception to a rule. We didn't hear again about many of such instances. It seems like since the popularity of the internet and from the mid-90s and on, that things have exploded in this area. So number one, my question is to you, am I right? And number two, if I'm not right, please explain what do you see as the cause?
Yeah, so there is no one cause to suicide. There are multiple, the way that we understand suicide is there's risk factors and then there's protective factors. So what you're talking about right now, the internet and social media, that is a risk factor. And unfortunately, now kids are exposed to things that none of us were exposed to growing up. Even if our children do not have direct access to the internet, they will know somebody who knows somebody who does. And some of the things that they're exposed to, I think it's very difficult to process in a brain that is just developing, because kids' brains are being developed. They're not fully grown. So there's websites, unfortunately, that will tell kids how to kill themselves. They will give them methods to succeed in their attempts. So before, we didn't have access to any of that. So I think that probably is the biggest change. Also,
So 1 second. So you do agree with me on that first point? That's what I'm hearing.
it is a risk factor that was not there before. Yes.
Go ahead.
Yes. So if we're talking about different risk factors, then you have kids who have a history of trauma, kids who, and I guess I can either talk just about kids or I can talk in general. So let me just talk in general. So risk factors are, for instance, a history of suicide in the family, having a mental illness such as psychosis. So some people will hear voices in their head that are telling them to kill themselves. And if they're not properly treated, they may act on those voices. So there's also bullying. Bullying has been found to be a risk factor for kids. Unfortunately, there have been multiple cases where kids are bullied not just at school, but they're bullied also throughout a 24-hour period through their social media. So in years past, when bullying was taking place, you can go home and be protected from that. And now that is not possible. So there have been cases in which kids are encouraged and end up taking their lives after in social media there may be things that are not true about themselves, that they are threatened that they're going to post this and everybody's going to know this horrible thing about you, even when it's not true. So another risk factor would be, for instance, a history of substance abuse. When either kids or adults have problems with either drinking or using drugs, their inhibitions are lower and they may be more likely to act on a thought that they wouldn't act on that if they were not under the influence of a substance. So that is a very big risk factor. If somebody is smoking weed or doing other drugs, that's very concerning. So yes, go ahead.
Thank you. So would it be safe to say, would it be correct to say that if we were able to create a situation where more kids wouldn't have access to as much social media, there should be a decline in the numbers of suicide by kids?
So what we could say is that if there's not as much exposure, that would be a protective factor.
Okay.
So it wouldn't be the only reason why the numbers would go down. But for instance, if we think about communication, a lot of kids now, their primary connection is through their phone or through social media. And we have found that having social connectedness is a protective factor. So being able to be with friends in person, doing things in person would protect them from exposure to social media.
Right. So with that logic, going to the Frum community, and let's say the Hasidic community, or not just in the Orthodox world, but not, it could be modern Orthodox. But I'm saying in the Frum community, wouldn't you think that there's less suicide? And it seems to me that that's not the case. Am I right or wrong?
Well, unfortunately, we don't have statistics specific to the Frum community. So and this is just anecdotal data, from what I have observed, even though there is an increase in the numbers in the Frum community, it is still lower than that of the general population.
So, in your opinion, what blockage blockages do you encounter with Frum parents when it comes to these issues?
I think it's a matter of awareness. That's why part of suicide prevention is educating parents in terms of what the kids are exposed to and how to be present, how to be able to have difficult conversations with our kids. So even though, because we think that our kids don't have as much access to social media, doesn't mean that they don't. So we also need to look at the role that having a history of trauma plays in increasing somebody's risk. I think that what I have noticed in the community is that when a kid is struggling, usually we look at parenting. What is it that the parents are not doing or not doing well? And if we only look at kids' struggles through that lens, it's a very heavy burden for the parents, because if we're dealing with an emotional issue, or if we were dealing with a mental illness, parenting is not enough to protect our children. So understanding the difference between healthy developmental adjustment to being a teenager versus understanding what may be the initial signs of, let's say, bipolar disorder or depression, trauma, schizophrenia, that would really be very helpful in freeing parents to be able to seek treatment and not just focus on their parenting. So that is what I see, that if I were to focus on one thing, it would be educating parents on how real mental illness is and the impact of trauma. So if we look at alcoholism in a family, if we look at addiction in a family, if we look at domestic violence, all those things, even though we may not think that the children are exposed to that they don't know that's going on, they can feel that in their environment, in the home. And when kids are not given a voice to be able to express that, that's when we begin to see that they may begin to harm themselves as a way of coping, which is not healthy.
Right. Have you experienced shame? Have you found parents in the Frum community to have great amount of shame, and it's very hard to break through to them because what's my neighbor gonna say? What's my yeshiva gonna say? What's my rabbi gonna say? You talk for a few minutes about that, please?
Yes, unfortunately, yes, there is a lot of shame associated with not having a kid who is stellar, who's able to do well in yeshiva, or who may not have a good resume for their shidduch. All those things play a role. And what I have seen is that we may try to protect the family or the children from it, but eventually it does come out. So, and I think that the way to deal with shame is by talking about it, understanding that it's nobody's fault, and that there is a way to deal with these things. But I think that we have a very long ways to go before we get there.
I want to share with you a personal experience that I had, and I'd like to hear your response, if I may.
Yes.
This happened about 15 years ago or so, 20 years ago. Someone came to me from one of the communities and said that my child, my teenager, wants to kill themselves. And they've tried numerous times. And I'm not an official counselor, but as a rabbi, try to help whatever I can. And they came to me, they said, can you try helping my son? I said, look, it's not my strength, but I'm a nice person. I'll talk to them. And today the person is married, has children, has a family, wonderful.
Baruch Hashem.
But and if you think I did or know what you're teaching and sharing and your expertise, the answer is no. Okay, but and this is what I want to mention, and I want parents to hear this, and I want principals to hear this. I became this young person's confidant. And when I became their confidant, they opened up. And they told me that sometimes they, were just scaring their parents. And sometimes they tried, but they really wouldn't do it. Okay, that's in this situation, right? What I feel, Roshana, we don't have enough of this in our school system. And specifically, it's not a teacher, it's not a parent. What you were talking about is, of course, educating the parents, very important, no question. But every young man and every young woman, every teenager, I feel needs to have what we call in Chabad a mashpia, what we call in the Orthodox world a madrich. What I'm calling and using the word a confidant. A confidant becomes your friend. Although I was so much older than this young person, I could be his grandfather. Okay, but I was so what they use the words they chilled out, laid back. Let's have a pizza together. Let's talk. Let's schmooze.
Yes.
We need in our system, I feel, to bring in people and to pay them, not freebies. It don't work with freebies and volunteers. To bring in such people who can put their hand around the young woman, the teenage girl, and walk around the block with her and talk to her. I could tell you, yesterday was the yahrzeit of my teacher in Hasidus, Rabbi Yoel Kahn, the master genius of Chabad Hasidus, the Rebbe's Choser. And I can tell you personally that more than what I learned from him intellectually, which was tremendous, was when he put his hand around me, that did more for me than all the classes that I took. My father tells me of his experience in Lod, Israel, in the 50s with his mashpia, who would endearingly call his name in front of other students with like a nickname, like not the regular name, which was a cliche of love, of closeness. And he felt like $1,000,000. What do you say about my thinking, how this is so important? And to me, I don't see a parent being successful in doing it. Sure, a parent has to bond with their children and go bowling and rapping, but an outsider who stands as a kind of intermediary between a parent, between a teacher, a rebbe, a girls' seminary principal, or teachers, in between, where they're not official, you know. They're not looking at your grades, and then and you can really talk it out. You know what I'm saying.
Yes.
So I feel that this is missing, and if we would start incorporating this us, you know, what they I think in the world, tell me, Ruskhana, if I'm wrong, they call it a big brother, a big sister, you know that concept. And if we brought more of that into the yeshiva world, into the Beis Yaakov world, into the girls' school, Beis Rivka, whatever, seminaries, you know, I think we would have another excellent tool, not as a replacement for the education for parents that you mentioned before and the other things, but an excellent tool to help these young men and women. What's your comment on that?
I agree. So that is the role that unfortunately social media plays. When there isn't somebody who understands, you can reach out to somebody on the other end who's gonna listen. And most of the time that person on the other end is not helpful because they may not know what you need because they may be a kid as well. So just building on what you're saying, when I was 16, so I came to the US when I was 16.
Bruce,
Yes.
I want you to say this in the next segment.
Oh, no, it's related to that, having somebody to talk to, actually.
Okay, but you have only 2 minutes, otherwise you get cut off in this segment. So let's start the next segment with
that.
With that. Is that all right?
Oh, absolutely. Okay.
Okay, so my friends, I've been talking here with a wonderful conversation with a new friend, a professional, and a Frum woman, Ruth Chana Pechenik from Buffalo, New York, who's a clinical psychologist, worked for the state, and now she's also doing work in the Frum community in suicide prevention. And in the next segment, which will be the next installment, we will talk about some of your personal life, your background, as well as continue the conversation here. So thank you very much for your time.
Okay.